to another comprehensive video on tinnitus. Introduction. Tinnitus is a common condition that affects millions of people worldwide. It is characterized by a ringing, buzzing, or other noises in the ears that are not caused by an external sound source. In this video, we'll be discussing tinnitus, including its definition, history, types, pathophysiology, causes, risk factors, signs and symptoms, treatment, epidemiology, and prevention. Definition. Tinnitus is a condition characterized by the perception of sounds in the ears or head that are not caused by an external sound source. These sounds can be described as ringing, buzzing, hissing, clicking, or other noises, and can be heard in one or both ears. Tinnitus can be either subjective, where only the person experiencing it can hear the sounds, or objective, where the sounds can be heard by an observer, such as a doctor. It can be temporary or chronic and can range in severity from a minor annoyance to a debilitating condition that affects a person's quality of life. History. Tinnitus has been recognized as a condition for centuries, with references dating back to ancient Greek and Roman times. However, it wasn't until the 20th century that tinnitus became widely recognized as a distinct clinical disorder. Types. There are two main types of tinnitus. One, subjective and objective. Subjective tinnitus is the most common type and is only heard by the person experiencing it. It is often described as a ringing, buzzing, hissing, or other noises in the ears that are not caused by an external sound source. Subjective tinnitus can be caused by a variety of factors, including exposure to loud noise, ear infections, and underlying medical conditions. 2. Objective tinnitus. Objective tinnitus, on the other hand, is less common and can be heard by an observer, such as a doctor. It is usually caused by a physical problem with the ear, such as a blood vessel disorder or a muscle spasm in the middle ear. Objective tinnitus can also be caused by certain medications or underlying medical conditions. Unlike subjective tinnitus, objective tinnitus can often be heard using a stethoscope or other medical device. Pathophysiology. Tinnitus is believed to be caused by changes in the auditory system, including damage to the hair cells in the inner ear, abnormal neural activity in the auditory pathways, and changes in the brain's perception of sound. Causes. Tinnitus can be caused by a variety of factors, including exposure to loud noise, ear infections, certain medications, and underlying medical conditions, such as hearing loss, high blood pressure, and head or neck injuries. Risk factors. There are several risk factors associated with tinnitus, including exposure to loud noise. Age. Gender: men are more likely to experience tinnitus than women. And certain medical conditions, such as hearing loss and high blood pressure. Signs and symptoms. The most common sign of tinnitus is the presence of noises in the ears that are not caused by an external sound source. Other symptoms can include difficulty sleeping, difficulty concentrating, and anxiety. Treatment. There is no cure for tinnitus, but there are several treatment options available to help manage the symptoms. These include sound therapy, cognitive behavioral therapy, and medication. Medication. There is no specific medication that has been proven to cure tinnitus, but there are some medications that may be prescribed by a doctor to help manage the symptoms. These include antidepressants. Some antidepressants, such as amitriptyline and nortriptyline, have been shown to be effective in reducing the severity of tinnitus symptoms in some patients. Anti-anxiety drugs. Drugs such as alprazolam, Xanax, and diazepam, Valium, can help to reduce anxiety and stress, which may exacerbate tinnitus symptoms. Lidocaine. This medication is sometimes used in the form of an injection or topical gel to help reduce the severity of tinnitus symptoms. Gabapentin. This medication is sometimes used to treat tinnitus, particularly in patients who also experience pain or other neuropathic symptoms. It's important to note that medication is not a cure for tinnitus and should be used under the guidance of a medical professional. Some medications may also have side effects, so it's important to discuss any concerns or questions with your doctor. Epidemiology. Tinnitus is a common condition, affecting approximately 10 to 15% of the population. It is more prevalent in older adults and is more common in men than women. Prevention. Preventing tinnitus involves protecting the ears from loud noise, avoiding ototoxic medications, and managing underlying medical conditions that can contribute to the condition. Conclusion. Tinnitus is a common condition that can have a significant impact on a person's quality of life. By understanding its definition, history, types, pathophysiology, causes, risk factors, signs and symptoms, treatment, epidemiology, and prevention, we can better support those affected by tinnitus and work towards reducing the impact of this condition on their lives. Thanks for watching.